Hi, I'm Dr. Kristen Kansevich, licensed professional counselor and assistant professor of counseling at Evangel University. We've been in this module 3, which is covering techniques in supervision. And this third and final video in this module is about experiential techniques that we can use in supervision. I think these types of things, along with interpersonal process recall, which is also very experiential, just make supervision a whole lot of fun and also help us focus beyond just kind of the day-to-day updates of the work into really developing our supervisees. And so I think these things are really fun. We're going to talk through some 3 different experiential techniques: role play, empty chair technique, and guided visualization. And these and other techniques are found in a book called Essentials of Clinical Supervision by Campbell. And that is just kind of a easy to read paperback. I would encourage you, if you haven't read that, to invest in that. It's definitely worth it for the ideas that it will give you. So it'll expand on many of the things that have been covered in this module. So let's talk about role play with supervisees. In the most basic, simple form of role play, you would have the supervisee play themselves, and you are playing the role of the client. And so this may be in a moment where, let's say, they feel stuck or they're thinking about trying an intervention that they haven't had a lot of experience with yet. They can basically kind of try it out on you. So you're, trying as best you can with what you know about the client to act like them. And, they can kind of be in that counselor chair, try it out, see kind of, get some of the words, to work in their mouths. And then they can also see some possible client reactions. So you could do the same role play 3 different times and show them kind of 3 different ways that the client could react, so that they can think about, what would be some of the potential consequences of bringing a certain intervention into play. You can also do a role reversal where you are playing the part of the counselor and the supervisee is playing the part of their client. And so this can also be useful, especially if they feel stuck in a session, they didn't know what to do. This is where modeling comes in, where you can model 1 or more interventions when you play the part of the counselor. It also kind of helps generate empathy on the part of the supervisee because they take on the client's role. And so as they speak in the client's shoes, they kind of connect with them in a different way, which in and of itself can be really valuable. Again, we want to be careful that we don't always jump into a modeling role, because we don't want the supervisee to think, oh, there's just one right way to do this, or like, my supervisor is the expert and I don't know what I'm doing. So we want to be encouraging to them, but there are moments where this role reversal can be really a helpful strategy. And then it's really important to process the role play. So after you use this strategy, take time to process their observations. If they were playing the part of the client, what did they learn or what did they feel? What about when they're playing that role of counselor? What did it feel like to try a more challenging intervention? Maybe what feelings came up for them, even just in the kind of immediacy aspect of, they're kind of showing their novice skills to you in the midst of a role play. If you're being the client and they're being the counselor, they're a little on display. And so even how did that make them feel? And what's the dynamic in the room between the 2 of you? So again, we're attending to kind of the supervisory relationship, hopefully building trust as we do this. We want to make sure that we're attentive to the vulnerability that's involved when we bring this. And I usually ask my supervisee if this is something they would like to try. So I do kind of get a verbal consent from them rather than just kind of telling them what we're going to do, because it is vulnerable and they need to feel like it's going to be beneficial to them and that they're emotionally ready for that. Another technique that we can use is the empty chair. And so again, you may have used this in your clinical work, maybe some other Gestalt techniques as well. But this can be really helpful if the supervisee is frustrated with a client or just kind of mad at them, annoyed by them. It might help them get out some things if they, imagine their client in the empty chair and, hey, there's no rules because we don't have to kind of have, clinical boundaries in the empty chair technique. And so, hey, what would they say? What do they wish they could say to the client that they have to keep kind of professionally bottled up? sometimes it just helps to kind of vent in that way and get it out, and then reflect on, kind of what came up for them as they kind of released that a little bit. You can also reverse this. And so after they've spoken to their client in this empty chair, then you could have them switch seats. And I would encourage you to physically have them move and then take on the role of the client. So what do they imagine the client wants to say to them? Maybe it's in response. Maybe it's what they fear the client wants to say to them. So again, this can go a lot of different directions. You want to allow for imagination and exploration here. Share your observations of the process, solicit from them, what does this feel like? What is this, bringing up for you? Again, we're doing a lot of insight development in this. And then one more aspect that can be useful here is exaggeration. Gestalt therapy also uses this technique. You can combine it with a role play or the empty chair piece, or just kind of have them basically act out an exaggeration of the client's statements or behaviors. So as they're acting out this exaggerated client, what do they feel? What do they notice about the client? What are you noticing? This can just springboard a lot of really great conversation that you can kind of observe and make comments and then solicit their insights as well. The other technique that we are going to talk about here is visualization and supervision. And this is really helpful if the supervisee is coming in anxious, frustrated, in a rush, frenzied in the middle of their day. If you're working with students, often they're extremely busy and stressed. And so we could consider using a visualization technique to just help them pause and slow down. So again, I've said this before in this module, but we want to stay in the role of supervisor. We don't want to become their personal therapist. However, I think we can just pause and say, hey, let's slow down in this moment. Let's just get ourselves into a place to just breathe and relax. So there's a couple different ways, the visualization piece and the relaxation piece. So if you were guiding a visualization, I usually like to set the scene in advance before we start. Again, also getting that verbal consent of, are they feeling up for something like that? But maybe they could imagine sitting across from the client that's making them feel anxious or stressed. And maybe just kind of loosely guide that. Okay, just asking questions like, what are you noticing about the client's body language? What are you feeling inside yourself right now? You could have them picture, imagine what it would feel like to be relaxed sitting across from this client. What would that feel like? What would that be like? What would the client be doing that would set you at ease? Again, this can point to maybe some countertransference that might be happening for them, or just reasons why they feel frustrated or anxious, that kind of thing. And then the relaxation piece, again, might be just, okay, they're stressed, they're, frenzied, and a relaxation exercise could just be beneficial to them in that moment. And so, again, in a supervisory role, you can use this as modeling to say, hey, you know what? I can teach you some relaxation techniques that you can use with your clients. And it actually, helps me as well. I slow down in my day. You're not necessarily saying to them, hey, you look frenzied and stressed. Let's relax. I mean, maybe you could be that direct, but you could also just kind of observe that they might benefit from something like that and kind of share with them the ways that you have benefited from slowing down. And so again, we're thinking about in the life of the counselor as they professionally develop, what skills can they use to, not burn out, not get stressed, manage stress, that kind of thing. And so even just speaking about self-care, self-compassion in the counseling profession, times that you use that, maybe moments that you use a relaxation exercise in the midst of your day, maybe in between clients or even with clients. Sometimes I benefit as much as the client does from doing a relaxation exercise. So just kind of having that be part of the conversation can also just be a really great training tool. That is the end of this module. So you've watched all 3 videos on techniques in supervision. If you have any questions, I'm more than happy to discuss any of these with you. And there's just so many creative ideas in supervision. So if this sparked anything for you or you have more follow-up questions, don't hesitate to reach out to me via email. You see that there on the screen. Would love to hear from you and connect. Thanks so much for watching.